today I'll be performing my head-to-toe assessment. I will enter the patient's room, identify myself, and let him know why I'm here. My name's Caitlin, and I'm here to do your head-to-toe assessment. I will ask him to verify his name and date of birth, and then I will perform hand hygiene and put gloves on. I will then pull the curtain for privacy and get the patient positioned in a way that'll make the assessment go smoothly. I will ask him if he's on any current medications, and then I will take his vital signs. Once I am finished with his vitals, I will go ahead and ask him what his height is, and I will go ahead and use the bed scale to measure his weight. Then I will start with a neurological exam. I'll use my pen light. I'm going to check for pleura, make sure his pupils are equal round reactive to light and accommodation. So I'm going to look in here. Another bright light. Check the other one. Alright, and then I'll have you look at the end of my pen light. And I'll have you look at the long and back. Alright, and then I will ask the patient if he has a history of any neurological problems. I'll test the patient's hand strength next. I'll have him squeeze my fingers, make sure that's equal. Okay. And then I'm going to go ahead and check the capillary refill while I'm doing this. And then while I have his hands, I'm going to go ahead and check his pulses and his wrists. Then I'm going to go ahead and check the strength in his feet. I'll have him push on my feet like a gas pedal and then pull back. Good. And then when I'm down at his feet, I'll go ahead and check his pulses and his feet. Okay. And then while I'm doing that, I'm also going to note the color and the warmth of his skin, if it's like warm, cool, dry. And then I'm going to test the sensation of his skin. So I'll have like a cotton ball and something sharp. And I'll have his arm, and I'll just ask him if he can feel that to make sure everything's all right. And then we will check his range of motion. I will probably start with the upper extremities and then the lower extremities. I'll ask the patient if he has a history of any joint pain, if he's had any surgeries to correct anything like that. And then I'm going to go ahead and ask the patient to go ahead and sit up on the edge of the bed so I can listen to his heart. So then at this point, I would ask the patient to remove his shirt or open the gown. That way there's nothing in between my stethoscope and his skin so I can hear the best. I'll listen to his heart in the 5 places, and I'll spend a minute listening to the apical pulse. And then I'll spend a minute there. And then when I'm here, I'm going to go ahead and listen to his lungs so I'm not moving him around so much. So I'm going to take a couple deep breaths. And another. And another. And another. And then I will move to his back and do the same thing. I'll have him take a total of 20 deep breaths so I can listen to all the different places in the lungs. Also, while I'm checking his lungs, I'm going to watch his effort while he's breathing to see if he's struggling, if it's difficult or not. Then I'm going to go ahead and ask the patient to go ahead and lie back down so I can listen to his bowel sounds. So I'm going to listen first. I will listen in all 4 quadrants of the abdomen. I will start with the lower right quadrant because that's generally where bowel sounds are most active. And then I'm going to listen until I hear bowel sounds in all 4. So once I've listened to the bowel sounds, then I'm going to go ahead and gently palpate the abdomen. I'm going to use light pressure with my fingertips. I will be checking to see if the abdomen is soft, if it's distended at all, if there's any pain. And I want to palpate after I listen because sometimes pushing on his stomach can make you hear things that aren't really there. Then I will ask the patient if he's had a history of any GI problems, when his last bowel movement was, if everything's been usual, or if there's been anything unusual. At this point, then I will go ahead and ask the patient if he's had any GU problems, if he's had any issues with erectile dysfunction, any UTIs, any problems urinating. If everything is okay there, I'm going to go ahead and skip that examination. At this point, I will ask the patient if he's had any history of like heart disease, high blood pressure, any lung disease, asthma, lung infections, or if there's any other medical problems he would like to discuss with me today. If everything is okay, that will be the end of my assessment. So I will remove my gloves, I'll perform hand hygiene, and I will document all my findings. If I were to find anything abnormal, I would go ahead and schedule a follow-up assessment.